Hey, density friends, this is Paul, Dr. Nacho. If I can help you in any way, please reach out to me at drnacho@dentalnachos.com, DRNACHO at dentalnachos.com, or just visit our website, dentalnachos.com. Today's patient talking tip is what happens when a patient leaves your office to go to an in-network dentist and comes back 5 years later concerned about the work that was done at that office. So that is what we are dealing with today. We had a patient, super nice, left our office, insurance changed, wanted to take her family to a different office, now is back with three things going on, and she is upset. So I have two intraoral photos taken by our associate, a bite wing and PA. I will describe them to you, and also if you're listening to this, there's a way for you to see this. So if you're looking at this with me, let's follow along together. First, objectively, what's going on? List of concerns. We have a tooth, the last one on the lower left, not number 18, last one on the lower left, missing a crown. A crown is a hard hat for your tooth. Thanks to Dr. Todd Fleischman, Center City Philly Dentistry. Dr. Todd Fleischman, awesome practitioner, awesome boost camp instructor. A crown is a hard hat for your tooth. It's missing its hard hat. The tooth in front of it, second one from the back, shows the sign of a cavity. This is why the patient came in, a brown spot around her filling. Now, a brown spot around a filling doesn't mean it's a cavity, but our associate took a look, took the Explorer, and sunk into this brown spot, so signs show it is a cavity around the white filling. Third, when we look at this PA and look at this bite wing, there is a shadow, a black spot, a dark spot underneath the white filling. So this doesn't always mean that there's a cavity patient, but signs show that sometimes there is. We need to explore more, investigate more, check into it more to really determine if it is. Now, what can we do? What happens if you do nothing? Explain that. Thanks, Dr. John Coyce. Awesome teaching. Then what are the things that can be done? A new crown on the tooth that's missing a hard hat. Remove the white fillings and the signs of decay, which are deep into the tooth. On your talking list, underline deep. Most likely, when a dentist does this, doesn't have to be you, the tooth will require a root canal or a root filling. The X-ray shows a dark shadow around these fillings. If this is decay, which it looks like it is, most likely it is deeper than it is on the X-ray, and it's going to go into the center part of the tooth. My dad had an awesome analogy for this, not sure where he got it from, like the wick inside of a candle. The decay or bacteria or bugs has eaten into the wax part of the candle, and it's close to that wick. So tell the patient in that moment, most likely these teeth will need a root canal if a dentist removes the white filling and the decay. So at this point, we're trying to get the records from the other office. We do not want to throw anyone under the bus, but I do want to point out this patient is really upset because she said that she requested the records twice and they have not been sent to her. I can't confirm that that's accurate, but when you have a patient in this scenario and they request records, I highly recommend you get to them, to the patient in the most efficient way possible. So we will update this story, but hopefully these talking points helped with how to discuss things with a patient who's concerned with work that was done in his mouth and is coming to you for a second opinion, and more than a second opinion, she used to be a patient at your office. As always, if I can help you, just reach out to me at drnacho@dentalnachos.com or visit dentalnachos.com. I love online interaction, but I love face-to-face dentistry interaction even more, and we have some awesome events coming up, so just check out the events sections of dentalnachos.com, and I hope to meet you one day.